Hi, my name is Evie Gentry. I'm currently in my 8th week of my first clinical rotation in the OTA program. It's crazy how fast it's gone by. I'm currently at the University of Kansas Health System St. Francis campus in Topeka, the hospital here. I am at the lymphedema and pelvic health outpatient clinic that's associated with the hospital, and then I'm also in the inpatient rehab department in the hospital over the weekends. I predominantly see in the pelvic health side, I see a lot of patients with different forms of incontinence. And then in the lymphedema side, I usually see patients with swelling in the bilateral lower extremities. And then in the inpatient rehab, I usually see patients with strokes, and then also different various forms of orthopedic injuries. I usually see, in terms of like orthopedics, I usually see like hip replacements and knee replacements. And then there's other outlying things that I see too, but it's usually strokes and orthopedic issues in the inpatient rehab. I did my in-service project in the pelvic health side of things. I did it over hyperpressive breathing, which is a form of deep breathing that the pelvic health therapists use to help encourage patients to be aware of their pelvic floor relaxing and contracting. Initially, I was wanting to do my project over Pilates and how the pelvic floor could be associated with that. I love doing Pilates personally, so I thought it would be really interesting to like kind of research and delve into how that's associated with deep breathing in Pilates in a pelvic floor. And then when I met with my CI to talk about it, she recommended that I look into hyperpressive breathing, specifically kind of narrowing down into the deep breathing portion of things. Currently, the pelvic health clinic is really interested in that area. So it was kind of like an experiment kind of intervention that she wanted me to kind of research. So she thought it would be a really good experience for me to do that. So that's what I did my project over. In terms of the presentation format, I created 2 different handouts over Canva. I created a practitioner and a patient handout. I followed a very similar format with what we've been doing with handouts in the OTA program. And I basically kind of compiled all the information into those handouts, and then I presented them to the pelvic health therapy department. So basically, before my presentation, I gave each pelvic health therapist a copy of the practitioner and patient handouts. And then in my presentation, I combined the information in both. So I kind of just went over both as I was talking, and then they were able to follow along with their individual handouts that I gave them. I didn't create a video PowerPoint with my project since I just went over the handouts and gave it to the practitioners there. I basically, in terms of the feedback that I received from my audience, it was to basically kind of delve more into the like intricacies of hyperpressive breathing and to get more technical. I think my presentation was pretty baseline in terms of the intervention and how it affected patients. So some of my feedback was to really like explain more kind of in-depth, like anatomically what this is doing to the patients as well as physiologically. So that was really helpful feedback for me to take on to my next presentation for my next rotation, is to really kind of like focus on going really in depth with what the intervention is providing to patients. And then in terms of how I felt about my project overall, I thought that I did pretty well. I think I really appreciated the feedback that I received from from the therapists there, in terms of really focusing on how this is affecting patients. And then also kind of being able to explain that to a patient so they could understand that. So kind of not using a lot of like medical verbiage when you're talking to the patients, even if you do go really in depth with the research in the handouts, to really kind of explain it to a patient in a way that they're able to understand. So I think that's one thing that I could probably improve on. For my next presentation, for my next rotation, is to kind of focus on really kind of researching thoroughly and then getting all the information I can, but then also organizing that in a way that if I am creating a patient handout, I can be able to discuss that with the patient in a way that they're able to understand it and not get lost in all the different wording and meanings of things. Overall, I was pretty satisfied with how I did. I think that I presented the presentation pretty well. I got a little nervous talking in front of everybody, so I was like really nervous before, but I felt a lot better after I did it. So I think overall I felt pretty good about my presentation. But I'm really grateful that they were able to tell me like things that I could work on too, so I could take those to my next rotation and be able to really implement that when I am giving my next talk in my next rotation. So that's all I have in regards to talking about my project. I am very proud of you guys. I'm sure you all did great on your presentations. Thank you.